So the next group of hepatitis is parenteral hepatitis, and the major pathogen in that group is hepatitis B virus. That disease is more prevalent in community worldwide, and actually it is related to unique structure of hepatitis B virus. It is double-stranded DNA virus, as similar to herpes viruses. That virus can establish lifelong latency in human cells, integrate genome in our cells, and infection is not possible to eradicate from our body. So family of the viruses, hepatnaviridae, means hepatotrophic virus, and DNA is the main genetic material. So hepatnaviridae virus belong to genus Portohepatnavirus, and correct name, full name of the virus is hepatitis B virus. So here everything is obvious. In clinical presentations, we have two types of disease. It is acute hepatitis B and chronic hepatitis B. Of course, chronic one is more aggressive and more severe. We'll talk why. So numbers about prevalence and deaths according to hepatitis B viral infection are different and then changing annually, but in general, about 1 million people annually dying because of consequences of chronic hepatitis B. Of course, it is very high level of mortality, and disease have significant impact on human lives. The highest number of infected people still detected in Africa region and in some Western Pacific region, but again, data is changing, and some differences can be noticed during annual period. So virus of hepatitis B is blood-borne virus. It can be transmitted by a number of ways, but actually it is identified mainly in blood, and outside body. Virus can survive for about a week and remains infectious for about a week. But anyway, classical way of transmission is blood transfusion, blood donation, or different contact with blood through instruments or during some medical manipulations. So virus is one of the smallest by the size among enveloped viruses, which are dangerous for different types of animals and human. And if you talk about the structure of virus, it is very unique and complex. 8 genotypes are described and named as the capital letters or English alphabet, first 8 letters. And it was noticed that actually prevalence of different genotypes is different in different geographic areas in different countries. And we have some differences here, but anyway, the structure of virus remains the same. We have 2 major antigens, HBs antigen or hepatitis B surface antigen, and HBC antigen or core antigen. So as we said, viruses have double-stranded DNA, but unique property of that virus or some it is incomplete. One strand of DNA is incomplete, as you can see on the picture in the center, and actually it makes some problems in virus replication, because when virus will start replication, short strand of DNA will be multiplied faster than a long one, and during every cycle of multiplication, one chain will require more time for synthesis, and the end of viral replication, again, virus will be packed prematurely before second strand of DNA will be synthesized. So surface antigen, it is a lipid envelope, as we said, virus is envelope, and core antigen, actually it is a genome of virus containing viral enzyme polymerase. And besides that, we have 3 proteins of envelope, which are acting as a separate antigens. It is large, middle, and small protein, which is abbreviated LHBS, MHBS, and SHBS AG, respectively. So if you will try to identify virus in human blood, and of course attempts to perform electron microscopy of infected people's blood were performed. Usually, it is possible to identify 3 different types of viral particles. So, 2 particles are almost identical. They are smaller in size, about 20 nanometers. They are spherical or in shape, and usually they contains only surface antigen of virus and some host-derived lipids. But the main genome of virus DNA is absent in those particles, and therefore those particles are non-infectious, and contact with that liquid will not lead to disease in healthy human. The third type of particle is known as infectious virion or Dane particle. It is larger in size. It is more than 40 nanometers in diameter. It have double shell structure. If you can see in the picture, quality allows you to see that large particle. You can notice that it is kind of one bubble within another bubble. So that is complete virion of hepatitis B virus. It contains material, genetic material, contains enzyme, contains antigens, and that particle is infectious agent which can lead to disease if blood will be injected or in the blood contact with that blood will occur in healthy subject. Besides that, we have HBe antigen. It is a protein which is identified in the blood of people when virus is in active stage of replication. So, of course, we cannot show you some photo or other because it is simple molecule of the protein and can be identified only in blood of infected subject. But presence of that particle indicates that subject is in period when virus actively multiplying. Of course, both infectious and non-infectious particles will be identified in the blood, and that stage is the most contagious. And actually, diagnosis or identification of HBe-Ig in the blood, it can be used to detect infectious state of the subject. And HBe antigen is mainly used in diagnosis, and different approaches are available. So as we said, 2 types of diseases are possible. Acute hepatitis B will occur as a usual classic hepatitis. We have multiple ways of transmission. So pregnant women can infect fetus through vertical way, through placenta. We have as well horizontal way of transmission, such as blood transfusion or organ donations. And actually, any contact, virus is very contagious, highly contagious. And any contact with body fluids, such as saliva or semen, can lead to disease. Of course, and that manner we have sexual way of transmission is one of the most popular ways. We have transmission through non-sterile medical instruments or needles and syringes during drug abusing. And recently it was one of the main methods in Russia as well, transmission through dental procedures, tattoos, and some cosmetological procedures as well. So the main idea that virus can be transmitted not only through blood but through other liquids, and actually use of multiple used syringes or some needles for tattoo and piercing, even if they were not infected with the blood, still virus can be delivered to a healthy subject. So nowadays, methods of control of the disease are more strict, and those ways are less popular. But still, anyway, you need to remember that if you like to make some tattoo or other procedures, it's better to perform them in a salon which have, or in some cosmetology room who have a specific license and appropriate license. And it's much better if medical professionals are working here, not some fast-teached people without proper education. And of course, you need to be sure that multiple use instruments, if they're expensive and not possible to use single use, should be properly sterilized with UV light, with some other methods, but they not be used for several times for different people. So acute hepatitis B manifests initially with pre-ecteric, means a period before jaundice or prodromal stage. Usually it is within a week, and disease will manifest with non-specific symptoms such as fatigue, tiredness, fever, body pain, muscle pain, and joint pain. And the only thing which can direct it to liver damage is elevation of ALT, aminotransferase enzyme in the blood. So, but very soon, even within a few days, subject will progress to main period or ectatic period, when all classic symptoms of liver damage will appear. Jaundice means yellow skin, dark urine colorless stool, and in that case, you will be known for sure that it is some liver damage. So again, usually disease is self-limited, and main number of people will have spontaneous recovery. In complications, it is again fatal fulminant hepatitis with acute liver failure, sorry, and some rare complications such as coma and severe jaundice can appear, but usually disease is mild to moderate and without any serious consequences for health. The main problem and the major problem is chronic hepatitis B, which can be observed immediately as the separate form, or it can be a result of previous acute hepatitis. People incompletely cured can progress to chronic form. And actually, hepatitis itself is mainly asymptomatic, and people will not know that they're ill infected with some serious disease, and only non-specific symptoms can appear, such as again discomfort in abdominal cavity in right upper quadrant, or some fatigue, problems with appetite, maybe bad taste in oral cavity, some bitter or some like that taste. And the major problem of chronic hepatitis B is two significant and very serious complications. It is liver cirrhosis and hepatocellular carcinoma. So pathogenesis is not detailed and described not so good, but it is a suggestion that complications have autoimmune pathogenesis when virus integrates its antigens in the structure of host cell, means hepatocytes carries antigens of viral of hepatitis B virus, and virus itself using lipid layer of host cells as an envelope for virus. And actually, during a long period of chronic infection, our own cells will recognize, our own immune cells will recognize liver cells as foreign by antigenic structure, because antigens of hepatitis B will be identified here. And our immunity will initiate an attack on our own liver. And we have two options here. If immunity will destroy liver cells faster than liver can regenerate, and liver have very good regenerative abilities. In that case, main amount of liver tissue will be replaced with the scar tissue, which will lead to liver cirrhosis. And of course, that complication is extremely dangerous, because liver cannot perform its function, and because of liver failure, people will die. And usually it is within first 5 to 7 years. So second possible option, if liver will regenerate faster than our immunity will kill hepatocytes. And in that case, that rapid and continuous overgrowth of the tissue will transform hepatocytes into cancer cells, and in that case, hepatocellular carcinoma will be observed. So again, it is a cancer, and of course, cancer have very high mortality rate, and in general, 5-year survival rate in those patients is about 50%. But again, as I said, a lot of them without treatment will die within the next 5 years. So in unique manifestations of chronic hepatitis B related to liver, we have palmar erythema, when palms of affected subject became red, as you can see on that left picture. Gynecomastia, when men will have enlargement of breast glands and looking like a female one in the center of the slide. And single elements of spider angiomata, it is a unique petechial lesion due to blood capillaries affected that can be identified in different parts of the body, and usually people not paying significant attention. But if you will identify that type of lesion, it's better to check subject on hepatitis B because it can be indicator of latent chronic infection. Few significant extrahepatic manifestations of hepatitis B are shown in that picture. It is unique type of annular lesions with enlarged and hypertrophied periphery zone and some changing on color, red over the body. Again, it is unique for hepatitis B, and sometimes it can be first or even the only manifestation of hepatitis B. And more dangerous, more severe complication, it is acute necrotizing vasculitis, when soft tissues of human body, skin and underlying tissues will undergo spontaneous necrosis. And as you can see on the picture, of course, it is extremely difficult to treat. Usually it requires significant and serious surgery. So some other types of rashes, such as acrodermatitis, especially in kids, can be observed, and glomerulonephritis due to abnormal immune response, again, can be observed in those people. So if you talk about diagnosis of hepatitis B, actually it's a little different for acute and chronic form, and it is complex and difficult in general. You can see on those pictures we have different antigens and different antibodies to look for in different stages of disease, and we have known methods, precise methods for every week of the disease. Sometimes we need to look for immune response, sometimes we need to look for some belong to viruses. As well, we can use indicators such as symptoms, jaundice, and elevation of aminotransferases in blood. But in general, as you can see, scheme of diagnosis is complex. If you talk about treatment, then specific therapy is not available, and usually we have only drugs to control viral replication, to inhibit replication on virus, and to prevent those dangerous complications as the liver cirrhosis and hepatocellular carcinoma. Till nowadays, we have two main drugs approved by World Health Organization. It is tenofovir and entecavir. They are known for some years, and today they lose already patent, and we have a number of generic drugs which are cheaper and more available than original one, but still treatment of hepatitis B remains expensive, and its average price with generic drugs is about approximately $10,000 for therapy, but still it's kind of available because in other drugs, and we will talk about hepatitis C treatment, is much more expensive. So if you talk about therapy of the disease, then duration of the disease, then again, complete eradication of hepatitis B virus is not possible because it is lifelong latency. And actually, drugs can only again inhibit viral replication, and therefore people who are infected with hepatitis B should continue with that course of therapy for the rest of the days. And of course, in that manner, it became expensive because every month we need to raise about $10,000 for therapy of hepatitis B infection only. So the main goal of medical professionals is to prevent infection with hepatitis B virus, and we have recombinant vaccines which are recommended in 3 doses. It is first hours of life, and 2 other doses are given with the DTP vaccines. First and the last means 6 and 14 weeks of the life. So if we'll talk about vaccination plan in India, you have 4 doses. Now, one is a birth dose, which is given within 24 hours of age, and 3 doses which are provided with the pentavalent vaccine in 6, 10, and 14 weeks of life. So few images of the vaccine. As you can see, we have adult dose and kids dose, and pentavalent vaccine, which contains 5 pathogens.